Did you know that colorectal cancer is the third leading cause of cancer death in the U.S.? This is why screening is so important. Here to help shed light on this disease during Colorectal Cancer Awareness Month is Dr. Susan Knoche, colon and rectal surgeon at East Cooper Medical Center. Thank you so much for joining us.
Yeah, no problem. Thanks for having me.
So that dreaded colonoscopy, a necessary step to staying healthy. Why should everyone get tested and when?
That's a good question. Everyone should get tested because, like you said at the start, colorectal cancer is the third leading cause of cancer death among men and women, and is also the third most common cancer outside of skin cancers. And then the reason you should get screening is because most people don't develop symptoms until the disease is pretty far progressed. And so screening is the best way to catch colon cancer or rectal cancer before it becomes cancer, or to treat it very early in the disease process.
And what are some of the symptoms? So I wanted to get into that because I think a lot of people, they don't necessarily pay attention to their bodies the way they should. What are some of the signs that people could look out for?
Alarming signs would be things like rectal bleeding, new abdominal pain, maybe a change in your bowel patterns compared to previously, or weight loss that is a little too easy. If you're not trying to lose weight and you lose 5 pounds or 10 pounds, that's a concerning feature for cancer. But like I said, those symptoms often don't occur until later in the disease process.
And are we talking colorectal cancer is something that happens later in life because screening typically is done at what age?
45 now, actually. It is a disease more common as you age, but lately more younger and younger patients are being diagnosed with colon cancer. I'm sure people have heard of celebrities being diagnosed with colorectal cancer or dying of colorectal cancer. And those people are young and healthy. And so the United States Preventative Services Task Force actually just recently raised the age from 50 to 45 to try to catch some of those younger colorectal cancers.
Goodness. Do we know what causes it?
A lot of it is genetic changes on a kind of molecular DNA level. You just accrue errors in your DNA over time, but there are some things that you can do to prevent progression or development of colorectal cancers. Risk factors like diabetes, poorly controlled diabetes, obesity, smoking is a big risk factor, of course, for most cancers, as well as eating a diet poor in raw fruits and vegetables and fiber. Those are protective. They're antioxidants that kind of fix cells and catch free radicals and prevent that DNA damage. So eating a colorful diet full of raw fruits and vegetables is great to protect you from colorectal cancer.
So that is why this particular cancer, though, is a little bit of a, I don't want to say mystery loosely, because you don't necessarily have to have a hereditary history that you've got it in your family and you're bound to get it when you reach that particular age. So it really sounds like there are a lot of things that we can do to prevent it even.
There are. Certainly screening is the most important way to prevent progression. And 80%, at least 80% of new diagnoses of colorectal cancer are the first person in their family who's ever had the diagnosis. So the majority of our patients are being diagnosed for the first time and are surprised, and they don't have a mom or dad or sibling that ever had colorectal cancer.
Is it a fast progressing disease? Because you think about cervical cancer, for instance, it takes a very long time for that to progress. It's also very easily screened. So is this something that is more rapid in its progression, or?
No, I guess you could draw a parallel to cervical cancer in that it's slower. And so a patient with very average risk can start a colonoscopy at age 45 and only have a repeat at age 55, so 10 years later. And that's acceptable because colorectal cancers don't progress quickly. Now, of course, that changes if polyps are found or if you have other risk factors. They might shorten that interval to 5 years or 3 years or 1 year even. But for the majority of patients with normal colonoscopy on their first scope, 10 years is recommended.
And Dr. Kanaka, we appreciate you taking the time to sit down and talk about this really important topic with us. We know you're a very busy doctor. In fact, you said that you had been performing colonoscopies all morning long. Yeah. So I'm curious, just as a final question, what surgeries and treatments have evolved over the last 10 years in treating this particular type of cancer?
Yeah, that's a great question, because I think sometimes the fear of getting screened is that, oh, well, if they find something, I'm going to end up with a colostomy bag and it's hopeless and it's a miserable death or something. And that's not true. Most colorectal cancers can be treated minimally invasively with tiny little incisions. And most folks can be put back together, meaning you take out a segment of the colon, you put them back, and their bowel habits are very similar to the way they were before surgery. And so it's very imminently curable, imminently treatable, and certainly something not to avoid, but just go ahead and get screened and then have surgery if you need.
Yeah, colonoscopy, not the most pleasant thing, so I've heard, but it's necessary.
That's right.
Thank you so much.